I wanted to tell you about a fantastic book that I read years ago, and I remember buying 27 copies and giving them away to family and friends. It's called The Heart Speaks by she's a cardiologist, Dr. Miriam Guarneri. Have you ever read it?
I've not read that book. I've heard about it. It's on my list.
Okay, good.
I need to.
Yeah. No, you really do. It's a great book, as I recall. So her mother died from a heart attack when she was very, very young. So the doctor was very, very young, and so was the mother. And so she decided that she wanted to become a cardiologist so she could understand how her mother could die so young. So anyway, the book goes into, it's a lot of her life experience, her personal experiences and her patients. The book goes on, she talks about the heart's intelligence and she gives evidence that it has its own nervous system and can make decisions independently of the brain, and that the heart has mental, emotional, and spiritual dimensions. And that if you heal a broken heart, whether it's from a loss of a child or a family member or love, it will have a profound impact on your overall health. What do you think?
I think there's certainly a mind, body, spirit connection for sure. I think it's interesting that across all cultures through all time, people have associated the heart with certain feelings. And why would that be? If it's all coming from the brain, like why would people have any inclination that anything would be coming from the heart? From a scientific standpoint, I have no real reason to necessarily know anything about any of that. But, the heart does have a nervous system for sure. In fact, that's half of what we're treating when we're treating atrial fibrillation sometimes is treating, neural feedback loops or whatnot. So, I don't know from anything that would be trackable anatomically, but I can say that when people are emotionally fit and spiritually fit, the physical will often follow. And when people get physically ill, they can sometimes lose some of that emotional and spiritual wellness or fitness, and that can be detrimental as well. So trying to keep those things in balance, I think, is really, really important for the overall kind of global nature of the patient.
Yeah, I just remember one great example she had in the book was a guy that the cardiologist had treated and done a lot of what they could, and then she sent them to a cardiac surgeon, and he just wasn't getting well. So they set him up with, maybe a therapist, I don't know, but somebody who helped him realize that something that had happened many, many years ago in his life. Anyway, once he healed that, he was miraculously well again. So it's fascinating. Read the book.